Good afternoon.
Good afternoon, ma. Let me inform them that you're home.
I still would like to wait for some other participants.
Yes, ma.
And if you can help me and maybe invite some of your
I'm already doing that, ma.
fellow students, that would be great.
Okay, ma.
I'm going to wait for a couple more minutes and then I start, okay? Good afternoon, Lillian. I just want to wait a couple more minutes for others to join.
Good afternoon, ma'am. Nice to have you back. Hope you're feeling fine now.
Thank you, thank you.
Thank you. We missed you.
Oh.
Yeah. Nice to have you back.
Yes, thank you, thank you.
Welcome.
Again, just a couple minutes, 2 minutes. See that. And if anybody else wants to join us this afternoon. It's a special day today. Why is nobody here?
They will join. I've informed them.
Oh, okay.
How is your health, ma? I hope you're much better now.
Yes, let me wait a couple minutes because I wanted to address that for everybody, okay?
Okay.
I hear a deep, throaty voice in the background. Whoever it is, good afternoon.
It's my baby, don't mind that.
Oh, I see. Okay, let's start the class. So, good afternoon, everybody. I hope you had a good day. Oh, I should turn on my video, actually. There we go. Okay. So I don't really know what was going on with me, but in retrospect, I think I might have had a kidney stone. And I don't know if some of you might have experienced it. It's excruciating pain. And then I had problems to figure out my insurance. I did not have insurance. I was in between insurance plans. And so that was really difficult to figure out. So I was really busy with that. And also not feeling too well. So that was one thing. But the second thing I would like to tell you about, because that was really, I consider that as really a gift life gave to me. You know, I have a sister who is 9 years younger than me, and we have not talked in 10 years. And that is because of some family dynamics. As you probably also know, it can be quite difficult. So 10 years ago, I decided, you know, they all live in Germany. I live in the United States. I lived with my family in the United States. So there was distance anyways. There were some difficult family dynamics, which made me feel really, really bad and very depressed. And I decided at that point I need to have distance from that, which was actually at that time a really good decision for me and my family. Anyhow, so we started talking again. My sister and I started talking again last year. And she came for a visit 2 weeks ago. And I tell you, it was wonderful. And it was as if there was not a day in between. And so I really consider that as a gift from life, that I have a sister now again. And we were traveling. I was showing a little bit of from Oregon, where I live, and we were in really remote areas. And I knew that the internet connection would be really bad. So I decided to tell you, let's not have the class. No, we had the class actually. We had the class. It was a Wednesday class. So we had the class and then we just left. Anyways, I just wanted to update you that I had a really good visit. And but that also put me a little bit behind. So I have to catch up. I tried to do some catch up this week. I don't think I was very good. So my dear students, I know how that is when life takes over and we cannot complete what we need to complete. So anyways, so let me talk quickly about the assignment. So overall, I am this semester, I'm truly impressed what you give me, because you do really well. I have the feeling that you have a good grasp on basic patterns. There are still a few things slipping away, and I will address them when I go through the assignment questions. I don't want to spend a long time on it because I was trying to give everybody a feedback within their assignment. So go to your assignment, see the correction. I try to highlight my answers or my comments. So see if you find them. It might be helpful for you to really understand the basics of what I was hoping for you would answer, and that will help you down the road. So I didn't post the assignment number 4 because I forgot in my little bird brain that we always have a week between the assignments. So I will assign number 4 today. And so you will find it probably then tomorrow. Again, we have a time difference of 8 hours. So let me get to the assignment number 3. So I think a few of you have also not done the assignment 3 yet. So today will be your very last opportunity, okay? So let's see. Number one was the question about the 65-year-old female that shows both yin and yang, kidney yin and yang deficiency symptoms. And I won't go through the symptoms. I think by now they are very clear. One thing I noticed in your assignment is that you, many of you wrote that lumbar back pain, sore back is a sign of kidney yin deficiency. That belongs really more to kidney qi deficiency or kidney yang deficiency, okay? And otherwise, you got it. And then there was the question, so how do you determine what is more predominant and what should you maybe start with treating? So many of you mentioned, well, just look at the symptoms. Are there more symptoms for yin or more symptoms for yang deficiency? And what I was looking for, and which I always tell you, is go back to the pulse, go back to the tongue, look at the tongue, feel the pulse. It will tell you what is more predominant. And many of you wrote it down, and that was very good. The second question, it was about why is kidney yang not in excess when kidney yin is in deficiency? Because in all other organ systems, we have this, you know, this balance of yin and yang. So liver organ system is a very good example. When you have liver yin deficiency, you will have a yang excess, which the heat will flare up and have all those symptoms of liver yang axis and or even fire, like headaches, red eyes, emotional outbursts of anger and irritation, these kind of things. So it's different with the kidney organ system. And we had classes that talked, and also the handouts talk about the relationships between kidney yin, kidney yang, kidney qi, the ministerial and the ministerial fire. So I would say there's still a few of you who did not grasp it. And my impression is it is because you might have attended this class or might have listened to the recordings, but it was not lodged within your brain, or you have not, and you have also not read the handout. So I will want to encourage you, for the ones who see in their assignments that you did not get points, read the handout, try to understand the relationship. So briefly, the ministerial fire is lodged between the kidneys. That is an anatomical reference. So of course, in Western medicine, we don't find a place for the ministerial fire, right? But in Chinese medicine, it's lodged between those two actual anatomical kidneys. And it's an energetic place, yeah? So the ministerial fire is expressed by kidney yang. So when kidney yin is deficient, so here is where the balance between yin and yang comes into play in that pattern. So kidney yin is holding kidney yang in place. So when kidney yin is deficient, it is not strong enough to hold the kidney yang in place. And with that, the ministerial fire. And that's what we call the ministerial fire is dislodged. It lost its rightful place. And when it loses its rightful place, the fire will move. It will move upward because fire is always moving upward. And while it is moving upward, it will bother the heart. And then we have all the heart symptoms, which are part of the kidney yin deficiency. It's not per se a symptom of kidney yin deficiency, but because we have this cascade of events, it belongs to the kidney yin deficiency secondarily. And these symptoms are palpitations, heart palpitations, insomnia, and especially anxiety. When the heart chi is disturbed, that's one reason for people to develop anxiety. And that's why you find so many menopausal symptoms who complain about anxiety. So that is the answer. Okay, then we have the question, why is liver qi, a smooth flow of liver qi so important when it comes to menstruation? And most of you really answered that perfectly. Some of you missed a little point, and that is liver qi is also responsible for the smooth flow of emotions. So, and when we have any emotional upset, it will affect liver qi, the flow of liver qi. So, and that is why any emotional upset, that can be anything. It can be sadness, it can be anger, it can be irritation, frustration, it can be depression, it can be anything, can influence the start of the period, or can influence the period in general. Okay, so that is also an important aspect. So, and it's not only that, we also talked about when women are traveling, when they change their environment, maybe they go live they visit relatives and live there in their house for a while. This all can change the onset of the period and also how the period is happening. It can cause more pain. So it can have an effect. Women are very sensitive in that way. The women's period is very sensitive that way. Okay. Then we talked about the relationship between qi and blood. You all answered it perfectly. I am not concerned about that. You understand that they have a similar relationship like yin and yang. They are codependent. And when you have qi stagnation, eventually you will have blood stagnation and vice versa. And they, anyways, you know that. So then the fifth question talks about what the symptoms of blood stasis is, and this were and the symptoms for cold, and how the difference is. You all answered that also perfectly. Just one little note: how do you differentiate between that? Only a couple students actually mentioned that. When you are not clear about the symptoms and you don't know, do I have blood stasis or is there a blood stasis because of cold? It's very mostly no, I don't think actually mostly. I had many women in the clinic who actually have a cold stagnation. A cold is obstructing the qi, and therefore we find qi stagnation or even blood stasis. And they were not aware that they have a cold lodged in their pelvic region. But how do you find out? Palpate. I cannot tell you enough. Use your hands. Palpate the patients. When the patient comes in with pain conditions, palpate. Try to find out where the pain is lodged. And exactly, And then you will also know what channels to treat and maybe what organ system to treat, or maybe you just do local treatment. Yeah. So with the cold is palpate the abdominal area, and of course palpate the lower abdominal area. So, and you don't have to go very deeply. You can just feel the area below the umbilicus. When that is cold to the touch, you know there is cold lodged in the pelvic area, and you can treat it accordingly. Okay. So then we talked about, the next question was talking about the progression of spleen Qi deficiency. Again, most of you understood what I was after, and some students answered that question I was not even expecting, and I thought, yeah, this is good. Okay, so what I was after was that you see that spleen Qi not holding the blood in the vessels, and spleen Qi sinking is a continuation of spleen Qi deficiency. So is an expression of more severe spleen Qi deficiency. That's all. So then, oh yeah, number 7 was the question about why do we find so many anxious menopausal women. So yeah, okay. All right. So we know that. Then the 8th question was asking you to find one disease, one pattern, and then also giving me different etiologies, different root causes for that pattern, and you all did it. I don't even have to say anything about that. So you understood that concept that one disease can have different root causes. So, okay, we got that. And last time we started talking about principle and methods of treatment, and we will continue with that today. So I have to be honest, I don't know if I have enough material. I think I do, because what was happening is I was writing the handout, and you probably all experienced that yourself one time in your life, at least. It disappeared. So I had to start anew. So let's see how it goes. Okay. So last time we talked about harmonizing the blood, harmonizing the Qi and blood. Then we went to the organ system, kidney. We talked about kidney, and we talked about forbidden acupuncture points in the pregnancy. Excuse me. We talked about the spleen organ system and how to resolve dampness. And today we'll talk about, I think we have not, and if we have, it's like a summary of that, yeah? So about the organ system, liver. So what patterns do we find? We find liver blood deficiency, liver yin deficiency, which would then the treatment principle nourish the liver. We can have liver blood stagnation or liver Qi stagnation. So the treatment principle would be eliminate stagnation and stasis. We can find damp heat in the liver. That would mean we clear liver heat and eliminate dampness, or we drain liver fire, or we subdue the liver yang, and we learned about the pattern internal liver wind, and the treatment principle here was extinguish liver wind. So what am I saying? So I told you I'm gonna try to teach you the ability to analyze a case study. And and it starts that we find the disease and that we find the patterns that are involved and that we find the treatment principles. And I don't think we have talked much about it. So for example, the disease is amenorrhea. And the pattern involved is liver blood deficiency, and the treatment principle is nourish liver blood. Yeah. So I don't know if you take notes at the end of a patient visit. Here in the US, you are legally bound to write everything down, and that is our pattern. We say the disease, we say the pattern, and we say the treatment principle, and then we say which acupuncture we have used to treat, and maybe and if we use other modalities, we write that down as well. So, nourishing the liver pertains to liver yin or liver blood. And why could we see liver blood deficiency? Maybe because we have spleen qi deficiency to begin with, which will lead in the end to blood deficiency and therefore also to liver blood deficiency. Why? Maybe we don't, the patient has not the right diet, so it can have dietary reasons. Maybe the patient is overworked, studies a lot, sits a lot. So for you students, it is important because you study a lot, and some walk around while studying, but many students sit. So sitting has always an effect, is always weakening spleen qi. So make sure you have a good diet, yeah, and have regular meals. That's important. Okay, so we also know liver blood deficiency can cause internal wind, and that can lead to tics, tremors, seizures and convulsions, muscle spasms, and itching. So deficiency of liver yin and blood could be a root cause for amenorrhea or infertility. Clinical manifestations are dizziness, blurry vision. So often and I now know why you do that. So when I ask for symptoms for kidney yin deficiency, many of you tell me blurry vision. And I'm like, why blurry vision? No, that belongs to the liver organ system. I now know that Machocha is listing that as a symptom for kidney yin deficiency. As I told you many times by now, I do use Machocha as my guide through, doing the handouts and doing your class, but I do not agree with everything he says. And I do think when you see blurry vision, it is mostly related to really liver blood deficiency or maybe liver yin deficiency, yeah? And that is important because you might not have an effect, you might not have much of an effect when you treat kidney yin or maybe even liver yin, So, and you might only make a change when you actually treat the liver blood. And just keep that in mind. Kidney yin is always so any problem with yin in the body, with the organ system yins, yeah, will of course be based on kidney yin because kidney yin is nourishing all yin in the body, yeah. So, but when I see blurry vision or vision problems, I do think liver organ system first. Okay. So floaters, sometimes they have floaters in our vision. Poor memory, general weakness of muscles, difficulty falling asleep. So that's a hallmark symptom actually. So when people come in with insomnia, ask more questions. What does it mean? Do you have trouble falling asleep? Do you have trouble staying asleep? when are you waking up? You know, so when somebody wakes up between 11 and 3, you know it has to do with liver gallbladder, because this is the organ time for liver and gallbladder. And many people wake up during those times. When somebody wakes up between 3 and 5, it's lung organ time. So that gives you some insight. Okay, what is going on? What do I need to treat? Okay. I don't know if you actually talked about organ times during Foundation 1. I don't know. If not, send me a text on Telegram, and then I will incorporate in one of our classes, okay? And find a diagram I can post in a handout. Okay. Another hallmark is dream disturbed sleep. So, and I'm not talking, oh yeah, I dreamt something. No, those are the people who wake up tired because they have the feeling they dreamt the whole night. It is not so much about what they're doing and what quality the dreams have. It's just the fact they dream a lot. So, which also means they cannot get into deep sleep. And why can they not get into deep sleep? Because the blood, and of course then with that also yin, is not strong enough to keep the yang in the inner realm. So that means the yang escapes and floats on the surface, which makes it that we are not deeply asleep. Okay? So the pulse will be thin and choppy, and the tongue will show you pale sides. So the sides is the realm of the liver organ system, and usually we see them red because we find that often that you know, especially in women also, they have a red sides and a red tip of the tongue, which shows you there is some, especially when you see that together, it is a sign there is some emotional upset. Yeah. And you don't even have to ask the patient, especially when you know the patient is probably not volunteering any information about the emotional life. That's okay. We don't have to. You still can address that. You can still soothe the liver, put in some soothing acupuncture points, and we will come to that later. Those are point combination I talked about before. So gynecological manifestations, short cycles, because there's not enough blood supply, pale blood because we have blood deficiency, small clots are possible because blood deficiency can always also cause a bit of stagnation. Dull achy pain in the pelvic region. Remember, dull achy quality of pain is always a sign for deficiency, and especially after the period. So the period is, of course, you have a greater loss of blood. So now you're even in more blood deficiency, and that will cause more of a dull achy sensation in, especially in the pelvic area. So herbs and herbal formula that nourish liver blood and yin. Bai Shao, that is the red peony root, nourishes the blood, and it also calms the liver yang. So when we have a situation, it's not just liver blood, but also liver yin deficiency. Bai Shao is a good choice because it really soothes the liver. It has an effect on pain. It will decrease the pain level, and it calms the liver yang. Then Gujizi is the goji berry. It nourishes the liver blood and yin. I don't even know if it's available in your country. Here it is a Chinese herb, but here we get the goji berry. You can buy it in our stores, and people, it's a tiny red berry. It has a form of a cylinder, and people put it in their cereal or in their oatmeal porridge, or they just eat it dry. So it's dried, it's a dried fruit, and when you put it in water, it gets mushy like a raisin, or you can just eat it in a dried form. Then Surbutang is an herbal formula. It nourishes the liver blood. I do not have the English name right now. Then we have Dangui Shao Yao Tang, which also nourishes liver blood. And then we have Swan Zhao Ren Tang, which nourishes the liver and heart blood. So that is a good formula to use when you have somebody who has a lot of dreaming and has trouble falling asleep. So when you see also heart-related symptoms. So then acupuncture-wise, with any liver blood deficiency, we have to think spleen as well. So always also support the spleen chi, support the element earth, and how can you do that? Stomach 36, the diamond, which is a point combination on the abdomen. It is Renmai 12 and Renmai 6 with stomach 25. It is a very nice combination because it does several things. It really tonifies the middle jiao, and therefore also the spleen chi. It also is very grounding. So I don't know if you heard it in Foundation 1, because you see remember the cycle and the order of the organ systems. It starts with wood, liver, and gallbladder, then fire with heart and pericardium, and so on. So that is the cycle. And the earth is between fire and metal. But in older times, so before TCM, so in classical Chinese medicine, remember, traditional Chinese medicine was invented at the time of Mao, so it's not that old. So in older times, the element earth was in the center of this circle, yeah? So all the other elements were circulating around the center, around the element earth. And that relates to this particular treatment protocol, the point combination. So the middle jiao is the center of our being. And when we tonify that, we not only tonify the earth element, and with that spleen chi, and of course also stomach, we also ground the patient. It's a very grounding treatment. So when you have a patient coming in who is emotionally upset and has stuff going on in life, it's always a good idea to start with that point combination, add stomach 36, let the patient sit with those needles 10 minutes, and then go back, feel the pulse, and see what else you have to treat. Okay? Patients mostly say that it is very beneficial. Okay, so then we can use liver 8, which is nourishing the liver. We can use kidney 3. Now, water is the mother of wood. So in tonifying the mother of the element we want to treat, we can nourish the element that is in deficiency. Yeah. So, and again, in this case, obviously, kidney is, of course, providing the resources other organ systems need. Then bladder 17 and bladder 18. Bladder 17 is a point for nourishing the blood, and bladder 18 is, of course, the black shoe point for the liver. Okay, that would be that. Then we have liver Qi stagnation and blood stasis. This is obviously a very pervasive pattern for women and in gynecology. So it is a frequent and major cause for premenstrual syndrome, PMS, and dysmenorrhea, so painful periods. And of course, also in the development of diseases such as fibroids, ovarian cysts, endometriosis, and in the end, cancer. Why? Because any stagnation, of course, will lead liver Qi stagnation will lead in the end, when it's long-standing and not resolved, to stasis. And of course, any stagnation and stasis leads to the development of heat. We know that by now. So then you have a very toxic environment, and then things can grow. So when something is not moving, things grow. So, and you know that, when you look at water, when you have stagnant water, you have the formation of algae, and you have the formation of all kind of things. And when they are too long in the water, it makes the water toxic. Yeah. And that's the same idea here. So now we will, later in the class, we will talk about fibroids and ovarian cysts, because those are diseases where we have also the participation of phlegm development. And endometriosis has more a component of cold also, and cancer has more component of toxic heat. But again, we will get into details with that later on. So, typical symptoms of liver Qi stagnation are emotional tension, distension in the epigastrium, hypochondrium, and breasts. And mostly we will see a viral pulse and a dusky tongue. Again, duskiness is not a color in itself. It is like a layer that is on the actual color of the tongue. So you can have a red tongue that shows duskiness. You can have a pale tongue that shows duskiness. So duskiness is like an opaque layer on top of the lung. Once you have seen it, you know it. Mostly it involves it. I actually have never seen that only a part of the tongue is dusky. When there's duskiness, it's the whole tongue that shows it. Another tip is when there's any stagnation, stasis in the body, the veins underneath the tongue will be distended and very blue. So if you're not sure, look underneath the tongue. When you see distended veins, then you will know, okay, there is stagnation somewhere. Okay. So gynecological manifestations are late periods and painful periods. Why late? Because the body tries to initiate the period, but then there is a lot of stagnation, and liver Qi is responsible for the flow of Qi in blood. So that makes it clear that we will probably see a delayed period. So we also said, the normal cycle is about 28 days. Some women have an earlier, a shorter cycle. Some have a longer cycle. That's okay. But when you have a woman who comes in and says, yeah, my cycle is always 32 days or even 34 days, very regular, but it's a longer period. You might also know, that might tell you that there is a general stagnation of liver Qi. Yeah, and you can address that. Well, most women will probably be happy to have a longer cycle, so you might not do that woman any favor. Okay. So it can also cause trickling and flooding. What does that mean? That is a pattern we will also talk more about probably next class actually. It means there's a little bit of blood, then it stops. And then there is one day heavy bleeding and then it stops. Then you have a little trickling again, and then it's another day of heavy bleeding. So it's in that way very irregular, yeah? And that means it cannot flow smoothly because we have stagnation or even stasis. So the menstrual blood will be dark and there will be clots. With Qi stagnation, we will find smaller clots. With blood stasis, we will find large clots. So that's a big difference there. Okay, so stagnation can be caused, as we already said, by emotional strain, but also by liver blood deficiency. So it is important to differentiate between both causes, since the treatment protocol, the treatment plan will be different for liver Qi stagnation due to blood deficiency than for Qi stagnation caused by emotions. Okay, let's get into that. So when we have liver Qi stagnation that is caused by emotions, we will have to address the liver Qi stagnation itself, move the liver Qi, but then we also should address the emotional content, the emotional tension that is there. So again, you know, it would always be helpful if the patient volunteers what is going on in life, because that just gives us more information and we will have an easier time to develop a treatment plan. But, you know, then you have patients that do not wish to volunteer that information, and that is okay. So we can ask more general questions. We can just ask, you can say, I don't need to know details. But it would be helpful for me to know the quality of the feeling you are mostly feeling at this moment. Is it anger? Is it sadness? Is it anxiety? Is it worry? You know, and I am sure the patient is willing to answer that very question without having the feeling she is supposed to give you all kind of details, okay? And then you can address it. You know, when the patient says, yeah, I'm anxious most of the time, I have a hard time, you know, you can support the kidney and you can support the heart organ system. So when the patient says, I'm really grieving, I'm very sad, then you know you can support the lung organ system and so on. So it's easy. Okay, so liver Qi stagnation, you have to address the liver Qi stagnation and the emotional content. In difference to when you have liver Qi stagnation due to blood deficiency, we know what to do. Address the liver Qi stagnation, address the blood deficiency. How? Well, we nourish the liver, but we also tonify spleen Qi. Okay? All right, so how do you recognize what is what? Well, liver blood deficiency, so again, go back to the pulse, go back to the tongue. The tongue might have pale sides, and the pulse will maybe thin and maybe choppy in the left guan position, which is the position for liver. The period blood is pale. You probably have a short period because there's not enough blood to dispel. And you might have small clots because of the stagnation. The period might also be early and scanty. So now blood stasis is the and for the emotional parts, so liver sheath stagnation and emotional content, you will not see pale sides of the tongue. They will be red, and you might see a red tip of the tongue. It's very often that you find a red tip of the tongue when women are emotionally upset, and that can be irritation, anger, can be anxiety, can be also maybe not with grief, but all the other emotions can cause this red tip of the tongue. Okay, so and the pulse will probably be a bit rapid. Yeah. So blood stasis is the result of long-standing chi stagnation, and the symptoms are similar but more intense. So the pain will be more intense. So with chi stagnation, the patient might experience more distension, discomfort, but with stasis, there will be pain. So again, I already said that instead of small clots, we find large clots, and the pulse is excessively wiry or choppy. And the tongue might have actually a purplish color, especially on the sides. So the period will be more late and very painful. The acupuncture points are the same. So what can we do regarding the acupuncture? Well, I do like the 4 gates. It really gets everything moving. This is large intestine 4 and liver 3. And how it is traditionally or classically needled is you start with the right. I don't mind so much the right and left aspect, but let's say I start with the left large intestine, then I do the right liver 3, then I do the left liver 3 and the right large intestine. So it's like crosswise. Gallbladder 41 also moves liver Qi, but in a gentler way than the 4 gates or liver 3. So now, that is a clinical tip. When you have severe blood deficiency, my approach would be gentler. So, because I do not wish to do a strong movement, because especially when you know there's already internal wind because of blood deficiency, you don't want to strengthen that aspect. Then I would start with Gallbladder 41, which still has a moving quality, but in a way more gentler way than liver 3. Then you can do local points, such as stomach 29, Zigong, which is an extra point, which brings some movement in the lower abdomen, in the pelvic area. Zigong is, I think it's called Stone Palace, and it's a point that is used in infertility and amenorrhea because it really brings strongly movement into the pelvic area. It breaks up stasis. And of course, you can use that point also for blood stasis and for diseases like cysts and endometriosis and fibroids, for example. So when you see that liver is overacting on stomach and spleen, so you have more symptoms in the epigastrium, in the hypochondrium, you can of course use liver 13 and 14 that moves the Qi in that area. Of course, qi stagnation, blood stasis gives rise to heat, which is then in excess in nature. The treatment method would be still to move qi and blood and clear the heat. So how can you clear the heat? Well, in the liver organ system, we have liver 2. Another clinical tip, often, so when we have a deficiency of liver yin especially, but also liver blood, it can cause headaches. And, you know, we often have, there are many, many women who have a migraine with the onset of their period. So premenstrually, but also during the period, every month. So how can you address the headaches by themselves? So one tip, you know, sometimes, well, there are points on the head that can address the migraine headache, like Tai Yang, which is the point right there where the headache is. But sometimes women might not like that you want to needle the head when they are so much in pain. So I like distal treatment in that case. So what do? I use, it's it's a painful treatment. And I tell the patients beforehand, because, you know, here many practitioners say, oh yeah, acupuncture is not painful at all, which I hate when they say that, because it's not true. Sometimes acupuncture is painful, especially when you use certain techniques, like the reducing technique, which I will talk about. So I tell the patient, you have migraine, so how much do you want to get rid of the migraine? Because I know I can help you, but it's painful. And sometimes the patient says, no. And some patients say, yeah, let's go for it. When the patient says, no, then you can decide, okay, shall we try 1 point? And if it's too much, we can stop it. And often the patient agrees to that. So then that gives you like an entryway to at least try. So liver 2. So when it is clear the headaches are caused by liver qi stagnation or liver blood stasis, use liver 2. It's mostly, you know, the points in the foot are very sensitive, so it might be more painful insertion. So walk the patient through that. And once the needle is in, you will so the intention is to pull the fullness that is in the head out with the needle. So I don't know if anybody talked to you about needling and intention. Let me lose a few words about that. So here you meet the patient, you have a treatment plan, you have a points like 3, 4, 6 points you want to needle, and you start. So you set the needles and leave the room. Chinese medicine is an energetic medicine. So Chinese medicine works a little different. It's not just throwing needles in and leaving the room. It is really about, when you set a needle, you are in energetic exchange with the patient. You connect with the patient. And don't take that lightly. And I also think that before we go in the treatment room or before we meet a patient, it is important that we get rid of our own personal strain and emotions and worries and all that. Try to leave that outside the treatment room, outside your meeting the patient. And I know this is not easy. And sometimes very hard, because we go through hardships in life, because we are also just humans. But take a moment before you start your job, just a moment, do breathing exercises. You know, we are all so much in sympathetic nervous system mode, you know. So let's try to switch it over to more to the vagus nerve mode. How do we do that? We breathe 1 minute, take 1 minute, breathe in, breathe out double time. So you breathe in on the count of 3, breathe out on the count of 6. It will switch the nervous system from the sympathetic fibers more to the vagus nerve fibers. Can be very helpful. Gaze into the distance. Just take a moment and tell yourself, I release all my worries, I release all my difficult emotions, I release whatever is going on for the time I meet the patient. That is only fair to the patient. Yeah. Okay. And then you meet the patient, and again, back to setting the needle, which I said is an energetic exchange between you and the patient. And you set your intention. When you read the classics, Sun Tzu Miao was, I don't remember when he lived. I don't remember that. But Sun Tzu Miao was a big figure in classical Chinese medicine. He is the one who invented the ghost points, which we can talk about later when you are interested. So Sun Tzu Miao was very strict regarding how the practitioner meets the patient. And he talked about what is happening when you set the needle. And yes, you set, and you're not just needling a point, you're really needling an area. We learn that the points is like a little speck on the skin, but in fact, it's an energetic area. We still need to learn point location, though. I will say that. But again, you set your intention. So because, let's say, let's take spleen 6. So spleen 6 has different functions. It nourishes all the yin in the body, but it also has a direct connection with the uterus. Okay. So now you want to needle spleen 6. Why? What is your intention? Do you want to energize the uterus? Do you want something happening in the uterus, or do you want to nourish all yin in the body? So that's what I mean, setting the intention. Let's say you really want to nourish the uterus. So then before you needle the point, you are aware of that. With this point, I want to nourish the uterus, and that's how you set the point. Yeah. Intention matter. Your thoughts matter because it's all energy. Remember, TCM is an energetic medicine. Okay. Okay, back to our handout. I got sidetracked, but I think it will be helpful down the road. Okay, I talked about liver 8, kidney 3, liver blah, blah, blah. I talked about that. Let me find my place. Liver 2, I talked about liver 2. Okay, back to liver 2. And then with the intention to draw out the fullness in the head. And how you do that? So you take the needle and you pull it. And it's not even a millimeter, so you pull it back in, and then you pull it out, pull it out, pull it out. And when you have reached the chi, so you put the needle in, first you have to, of course, reach the chi. And how does that feel? It really does feel as if you have a fish on the fishing rod. Something very thick, something very dense is at the tip of your needle. And that is what you're trying to pull out. You pull, pull, pull. And it can take a minute. When it's too painful for the patient, give it a rest and come back later to that. At some point, it will completely release and the needle will feel as if it is sticking in a void. That's the moment you ask the patient, how is your head now? How is your migraine? And the patient will tell you, oh, it's much better. I promise. Okay, that is liver 2 with reducing method. Then we can use, so we have heat. So liver 2 is obviously the fire point. So that is used to reduce liver heat. Gallbladder 34 is reducing heat in the liver organ system. Then you can use the 4 gates to get everything moving. So when the stagnation is causing heat bothering the heart, then you can also add heart 7 or even heart 8. So when you see another clinical tip, when you see that the tip of the tongue is very red, raspberry red, very, very red, and you see a lot of anxiety and you see a lot of palpitations, so really heart symptoms, in severe insomnia, and the red tip of the tongue, I would use heart 8. I don't use it very often because guess what? The palms are also very sensitive, and acupuncture on the palm does hurt. The insertion does hurt, and so heart 8 is about here, and I would use the same technique as I just told you with liver 2. And I learned at school that how the tongue appearance, the appearance of the tongue is changing very slowly. You won't see any changes in 1 or 2 or even more treatments. And I think that is not true at all. That is not true at all. When I look at the end of the treatment at the tongue, it changed completely the appearance. So, and when you do the heart 8 with reducing method, and you keep, then, you might do it in the middle of the treatment or maybe in the beginning even. You can even do it at the end, and you look again at the tip of the tongue, it will change immediately. It's one of those really fascinating facts for me in TCM. Okay. Let me see. Lavith is asking, what if you see black spots at the tip of the tongue? Black spots. I have never seen, okay, let me think, because I have never seen black spots at the tip of the tongue. I have seen a black coat on the tongue, more towards the back, actually, in the last third of the tongue. And that was a patient who was really misusing his pharmaca. So he had a lot of medications for depression, and I knew he was misusing them. He was taking too much, and he was taking it for many, many decades, and that was causing toxic heat and this particular coating. So now let's go back. Black spots. I would think about maybe stasis. I don't know. Black spots at the tip of the tongue, it's the heart region. So I would look at the heart organ system. And then I would look at other symptoms. What is wrong? Are there any other heart symptoms? Are there any kidney symptoms? And go from there. And that's all I can say right now. I would also look at medications. Are there any medication that could cause it? Is there any misuse of medication? Are there heart medications? So I would look at those things. And then, of course, It can also be, certain things on the tongue can also be constitutional. Some people, for example, have what we call a peeled tongue. So it's looks like yin deficiency, severe yin deficiency, but they do not have yin deficiency because it's constitutional. So I would look at that also with other appearances. So that's all I can say. I hope that answers a little bit your question. Okay. All right. So, okay, you're welcome. So if the stagnation and the stasis results from emotional upset, you can also use acupuncture methods to ground the patient. Use a diamond on the abdomen with stomach 36, what we mentioned already, and then move the stagnation and clear heat. You also can use when the diamond alone, so when my 12 and 6 and stomach 25 is not enough, you can use what we call the double diamond, and you can add spleen 15, Renmai 4, and Renmai 15. So that's what we call a double diamond. You can also use two other point combinations I find very helpful in calming, soothing the patient is, I already talked about the 3 Buddhas. Buddhas, again, because that was the religion at that time in China. It's the point combination pericardium 6, lung 9, and heart 7, both sides. Is very calming. And another point combination, which I really, really love, it really is calming. I learned this point combination for just depression, but I also started using it for anxiety, and it had the same effect. So this is do 20 and do 24 needle towards each other. So do 20 by Hui, the highest point of the head. Do 24 is an inch within the hairline. So let's say that's about 2.5 centimeter. So it has a little dent. So it's easy to find when you move your finger. So, and then you needle those points towards each other. You add yin tongue, this is this one, and gallbladder 13, which is next to do 24. So gallbladder, it's about maybe 1.5 centimeter. So we know gallbladder 14 is about here. So go up. Next to do 24 is gallbladder 13. So those 5 points, do 20, do 24, yin tongue, and gallbladder 13 in combination has a very soothing, very calming effect. And it doesn't matter what you have. ADHD, ADD, depression, restlessness, agitation, anxiety, doesn't matter, has a soothing effect. I would maybe put in stomach 36 in first to have some grounding point, and then do that point combination. So of course, another reason in the liver is liver yin deficiency with liver yang rising. So address the heat, but also address the liver yin deficiency with kidney 3 and liver 8. And the liver yang rising, so we have to soothe the liver yang. Again, liver 2 reducing would be one method, and also liver 3. Okay. So common symptoms are headaches, red eyes, dry eyes, irritability, high blood pressure. So now high blood pressure is something that's so prevalent. And of course it is caused by aging. It's caused by because the vessels are getting harder and the blood has a harder time to flow through the vessels. That is one reason. We also call it having cholesterol in the vessels. And then also dietary reasons, but also emotional reasons. So, you know, when you look at the, I mean, I had my blood pressure taken the other day. So I have really low blood pressure my whole life. And now that I'm aging, the blood pressure is rising naturally. And it's a good thing. Here in the US, you know, every doctor thinks it's now a law. Yeah. Your blood pressure has to be at 120 for the systolic value. And it doesn't matter how old you are. So they give blood pressure medication to, let's say, 80-year-olds that have a blood pressure, let's say, of 140 or 135, because they wanted to go down to 120. And I'm like, oh my God, this is even dangerous. No, an 80-year-old will naturally have a higher blood pressure than 120. 120 is good for a 20-year-old, 30-year-old, maybe even 40-year-old, and maybe even for a 50-year-old, but you already will see some elevation naturally. And I think it's not a good idea to bring it down to 120. Anyways, that is my blood pressure here. Anyways, so what I wanted to say, so she took my blood pressure with a cuff and an electronic device, you know, which pumps it up electronically. And she pumps it up, and she pumps it up, and she pumps it up. And guess what? When she was at 200 or something, I was in pain. You know, it's painful. And then she released it very slowly. So I was at least in intense pain for a minute or two. And then when she was done, oh yeah, it's a little elevated. It's 130. And I'm like, yeah, what do you expect? I was in pain. And so as soon as you're in pain, the blood pressure will be elevated. And it goes like this. It doesn't take minutes and minutes and minutes to be elevated. It goes like this. So when you have pain patients who are in severe pain, don't even try the blood pressure because it will be high. Yeah. Okay. So that's my high blood pressure spiel. Again, liver young rising dizziness, tinnitus. So tinnitus has two forms. So when you have a high pitched tone that belongs to the organ, to the liver organ system. When it is low pitched, it belongs to the kidney organ system. So gynecologically, heat is causing early periods. No? Heat in the blood is always causing early periods and heavy bleeding. So yin deficiency, we will have pale blood. If due to stagnation, clots are possible. And so let's talk about the difference between liver young rising and liver fire for a moment. Liver fire is not due to liver yin deficiency. It is mostly due to suppressed emotions, especially anger. The symptoms are the same, but they are more intense. So again, we can use liver 2 reducing, heart 8, large intestine 11, also clears heat, the 4 gates to get everything moving, stomach 36 to ground. Okay, then we have the organ system heart. Almost done. So the heart governs the blood. And we hopefully remember heart qi is inducing the period via the Bao Mai by descending the heart qi and the blood. And the heart blood is giving the Tuan Gui the red color of the blood. Okay. So following patterns are important: heart blood deficiency, heart blood stagnation and stasis, heart fire, and heart blood heat. Heart blood deficiency causes scanty periods, late periods, short periods, amenorrhea and infertility, the blood is pale. Other symptoms are heart palpitations, fatigue, and dizziness. So the treatment principle here would be to nourish the heart blood. How? With Heart 7, which is the UN source point, Renmai 15, Bladder 15, which Bladder 15 is the back shoe point for heart, Renmai 15 is the front move point for the heart, and Bladder 17. Spleen 3 for the aspect that spleen Qi is maybe deficient, which will have an effect on the blood production in general, stomach 36, diamond, and Renmai 12. So the spleen 3, the diamond, Renmai 12, and stomach 36 are more linked to the idea that spleen, the digestive energy is not strong enough to produce blood. Heart blood stagnation and stasis can cause late periods, amenorrhea, and infertility. So the treatment method here would be to move and invigorate the blood via spleen 10, pericardium 4, and heart 6, which are Qi cleft points. So that means they treat obstruction in the channel, and Renmai 17. So then we can have a heart heat or fire. So the heat in the heart can turn into fire. So it's an extended heart heat. And when the heat keeps building up. Symptoms are palpitations, restlessness, anxiety, insomnia. We will see dark, scanty urination and early periods. Again, any heat situation, heat in the blood will cause early periods and heavy bleeding. So what do? We can reduce Heart 8, which we talked about. We can use Heart 7 and Heart 3 to nourish the heart. So then another pattern is cold in the blood. Comes into existence by, of course, invasion of cold, which is excess cold. So it's a external pathogenic factor, or by kidney yang deficiency, which is, of course, an internal factor. It's empty cold. So that will affect the uterus by obstructing the flow of Qi and blood and cause Qi and blood stagnation or even stasis. It leads to late periods, painful periods, dark blood with large clots. So again, we talked about the differentiation between stasis and a cold situation. Do your palpation of the abdomen. If it's cold, you know there is large cold in the pelvic region. So then, of course, you also need to know what pattern do I see? Is it kidney yang deficiency? Is it external cold invading the interior and be lodged in the pelvic region or uterus? So the most important treatment method in a cold situation would be obviously warming the uterus with moxibustion. So which points are important? Renmai 4, Renmai 6, and maybe stomach 29 or Zigong. Use moxibustion. This will be your best treatment method. So then, of course, when we have a kidney yang deficiencies, Renmai 4 would be the point. Again, moxibustion is a good method as well. When you have kidney yang deficiency, you might also think about bladder 23 and DO-MAI 4, also for moxibustion. So when you have a cold situation, moxibustion is the way to go to, is the method to go to. So then, of course, we can have chi flow disharmonies. We can have a rebellious chi situation, which means the normal direction of chi flows is reversed. We can encounter that in nausea and vomiting, rebellious stomach chi, but also rebellious chi in the Chong Mai. Remember, in early pregnancy, usually the chi in the Chong Mai flows downward. It will eventually reverses, at least partly, upward to go to the breasts, and that can it's rebellious chi, but not in a pathogenic way. But it can cause nausea and vomiting as well. So that would be not pathogenic in a way, but when we have nausea and vomiting in early pregnancy due to spleen and stomach chi, rebellious stomach chi, that would be more a pathogenic situation. There is this saying, when the digestive system is strong, when the spleen chi and stomach chi is strong, you will not have nausea and vomiting in pregnancy. Anyway, something to think about. It's not that it's not the chi in the Chong Mai. Sorry, I need to take that back. It's really the blood. You know, the Chong Mai is full of blood. It's a sea of blood, and of course there's also chi, but the main aspect is really the blood. So we have the blood flow that it is reversing its flow and can cause nausea and vomiting. So what are the acupuncture points we could use? For the Chong Mai, spleen 4 and pericardium 6, those are the opening points for that channel that will support the Chong Mai. Pericardium 6 is a known point for nausea, and we can also use stomach 36 and stomach 21 to treat the stomach chi, the rebellious stomach chi. And in that case, we would needle downward to give the intention. We want the rebellious chi to reverse its flow and move downward again, which is the natural flow of stomach chi. So let's talk about a few acupuncture points that might also be helpful in gynecology. Just a few minutes. And so we have stomach 29. We talked about that. It's called return. It regulates the menstruation, eliminates blood stagnation, and is used for infertility, amenorrhea, and for a cold uterus. Then we have stomach 30. It's rushing chi. It is, what is the pelvic bone called? It's a pelvic bone, so it's really in the lower abdominal area, and many of you might not feel comfortable using that area for acupuncture. So you don't have to. There are many other points. Usually it's not a problem when you cover the patient adequately and you talk the patient through it. Yeah. So be aware, female patients who have a history of sexual abuse, I would be very cautious, because you don't know what can trigger that experience, that trauma. Okay? So sometimes we do not know that. So you have to really observe the patient closely, when not just that deep down in the abdominal region, the pelvic region overall, also when my 4 and 6 and stomach 29, which are already really low in the pelvic region, in the lower abdominal region. So observe your patient if she is comfortable with it. If she is not, you can see the signs, you know. You see that in the eyes, in tension in the body. Be sensitive and address it. Ask the patient, are you comfortable? How can I make you comfortable? Is it okay when I needle that point? Shall I do something else? And maybe we can come back later to that. Explain why you want to use the point. Explain why this point is good for the treatment. So the more information the patient has, the more the patient is maybe willing to agree to the treatment. Okay? All right, so stomach 30 is regulating the qi in the lower jiao and the chongmai. It's a crossing point of chongmai and stomach channel, so it can be very beneficial when you have problems with the chongmai and then also with stagnation in the lower jiao. Kidney 11 is next to stomach 30, called crooked bone, supports also the lower jiao, is good for pain and fullness in the lower jiao. It's a crossing point for chongmai and the kidney channel. So then we have kidney 13. It's called qi hole, regulates the chongmai and the renmai, is for menstrual problems and infertility. Then we have kidney 14. It's called fourfold fullnesses, eases pain, regulates the qi, breaks up blood stasis, supports the water passages, and the urination is retention for irregular menstruation and stabbing pain. So I never use kidney 14, but maybe I should. It sounds that this is an important point to address many different situations. So it says it supports the water passages. Let me say a few words about that. So when we have urinary problems, a good combination, point combination is, and I should add that to the handout, is kidney 3, kidney 7, spleen 6, spleen 9, stomach 28, which is also on the lower abdomen, renmai 3, and renmai 9. It will address leakage, urinary leakage, and also incontinence, especially in women, which can happen after birth and with aging. Okay, then renmai 4 strengthens the jing, strengthens kidney yang, tonifies the yang in the body, and strengthens the kidney in general. Then we have renmai 6, strengthens and regulates the qi in the pelvic area, addresses all pelvic issues, resolves dampness. Why? Because it does have a link to spleen qi, to the spleen organ system. So that's all I have to say. So if you have questions, please text. Oh, there is one text. Oh, okay. No, that was from previous times. So if you have questions, try to ask. I'm not sure if I can understand you. Text me the questions. If now, that's fine. I have a bit more time. If not, you can always ask me questions later on, obviously, and I will try to address it. And if there are no questions, I will conclude this class, and I hope you have a rest. Okay. There is a question. What can you say about cupping on needles? That would make sense. So cupping is invoking a strong suction, right? The strong suction, guess what would happen? It would pull the needle out. So that doesn't make a lot of sense to put a cup on a needle. right? So, but what you can do, which is called wet cupping, you can plum blossom needle. So I don't know if you know that in Nigeria, it's like a little hammer. And the little hammer, it's just this big. The little hammer has spikes, nine spikes. And you can hammer an area. It doesn't really hurt, you know. It is uncomfortable when you hammer the same spot like 50 times, yeah. So you can hammer an area. You can, we have bloodletting needles that are a little thicker. You can make little holes, 3 or 4, and then put a cup on that. So that will lead to bleeding. The strong suction will get the blood out of the vessels, and that can have a relieving, it can be a relieving treatment, can really break up blood stasis and move the chi. I hope that answers your question. Any others? I give it a moment. Otherwise, I wish you a good evening and thank you for attending. I will read the handouts. Again, I can just tell you, my handouts are really thorough, and I try to put everything in there. I say more during the recordings, so you should know that there's more information during the recordings. I will try to give you always some clinical information. I have clinical pearls, maybe. You will not find those in the handouts, so it's always a good idea maybe to listen to the recordings or watch the recordings, and otherwise go to the handouts. All test questions, all assignment questions, all test questions, all exams questions that come from me will be based on the handouts and on nothing else. That means you don't have to do research. You don't have to read a lot in the internet or ask AI or this or that. Not necessary. Everything you need to know is in the handouts. I promise, it's really true. So read the handouts. Okay, so all right. Well, I wish you a good week. I will try to finish all the assignments I have not done yet. I think there are only a few left I have to grade, and I will post the assignment number 4 soon, and then let's see each other next week. Okay, bye-bye.